Are COVID-19 vaccines safe for kids? Hi, I'm Dr. Abe, Associate Professor in the School of Nursing at Western University. And here on What the Health, I want to make your healthcare questions clearer. So, big news these days is vaccination for kids age 5 to 11. As these have recently been approved by the FDA, they're now being reviewed by the CDC in the US and under review by Health Canada, here where I am in Canada. So one of the important things that has happened throughout the pandemic is that governments have made data open like never before. We can get in there and we can see as granular as we want into the statistics around everything from vaccination to infection rates to vaccine efficacy, all those things. And so we can actually look at the studies that the government's using to consider approving these vaccines ourselves, and we can see what's going on. So that's what I want to do, is I want to look into what we have in terms of the data and what this tells us around safety for COVID-19 vaccines. However, before I did that, I wanted to talk about vaccine safety in general first and what we know from adult and youth populations. So there's been 6.9 billion doses of COVID-19 vaccines administered globally so far. And we're starting to then get a really strong sense of what the number of adverse events are for these. In Canada, we see a rate of 0.004% having a serious adverse event, or we can be very specific. We can say 783 serious adverse events out of 22.1 million doses. With 1.7 million Canadians out of 38 million having got COVID-19, we can see that you're about 1,000 times more likely to get COVID than you are to have a serious vaccine side effect. And at a 1.7% case fatality rate for COVID in Canada, you're again more likely to die from COVID-19 than you are to have a serious adverse effect. So preventative medicine and vaccination is always that matter of balancing these kinds of odds or probabilities. And so we see with adult and teenage populations that the odds are very much in favor of getting the vaccine. So then secondly, what do the trials actually tell us specifically about kids under the age of 12? The study that they're using to review the efficacy and the safety was done with the Pfizer vaccine and reported on 2,268 children. 2/3 of those got the vaccine and 1/3 got a placebo. And from this, 16 of the kids who had the placebo ended up getting COVID, and 3 of the kids who had the vaccine got COVID. And remembering it's twice as large a group of kids who had the vaccine. So less cases amongst much more people. And so, of course, then that's showing that it is safer in terms of protection from COVID to get the vaccine. They also found that those who had the vaccine, they had lesser symptoms when they did get COVID, the same as we've observed with adults. So it's not really surprising that the vaccines are working. But what's most important to parents, I know as a parent myself, is are they safe? And so in that study, they had 0 serious adverse effects. Now again, this isn't terribly surprising because the rate of serious adverse effects for adults is 1 in 25,000. So with 2,200 kids in the study, we would expect 0 and 0. That's great. It's what we got. But what does this mean when we then start scaling vaccination up to 2 million kids under the age of 12? I think Dr. Brian Conway, the medical director for Vancouver Infectious Disease Center, really said it best to CTV when he said that, essentially in vaccinating 2 million kids, we would expect around 35 to 50 serious adverse effects. However, if we left this same group of kids unvaccinated, over time we'd anticipate about 400 COVID-19 deaths. So again, when you look to the probabilities, the better thing to do, the safer thing to do, is to get vaccinated. So then my third and final point is, what does this mean for parents? I think honestly, it's still a little bit uncomfortable because I think psychologically, there's something that's harder about knowing if we do something, there might be some risk to it, than if we just don't do anything. And it's easier to kind of neglect giving the vaccine, and it's, well, there's a pandemic, some people were going to get COVID, than it is to say, well, if we do something to our kids, there may be this even very minuscule risk of a harm. So I want to acknowledge that there is anxiety, and that's fine. It's normal for parents to worry about that. However, I do think the balance very clearly tips in favor of getting vaccinated as the safer thing to do. And apart from the math on getting vaccinated as safer, I think there's a very important community factor that is really the same reason we've all been rolling up our sleeves and getting vaccinated, even though many of us are younger and healthier and of lower risk. And that's the idea that we have to cut off the spread of COVID-19. Not just to protect our kids, not just to protect ourselves, but to protect everyone, to protect our healthcare workers, the elderly, the immunocompromised, and every single one of our neighbors. So we only really bring this pandemic to an end at the point where the virus runs out of steam, the point where each and every single one of us is the point that it stops spreading. So I'd say don't just get your kids vaccinated to give them a better odds at being healthy, but also get them vaccinated so we can expedite our return to normal. So that's what the health is going on with vaccines for kids.